What if the most shocking medical scandal in American history didn't involve secret laboratories, foreign enemies, or illegal experiments, but instead unfolded quietly, in public view, for 40 years, with government approval, academic support, and almost no resistance? In the summer of 1932, Macon County, Alabama looked much like it had for decades. Red dirt roads cut through cotton fields. Small wooden houses stood beneath the heavy southern heat. Life moved slowly, predictably, and painfully for the black farming families who worked land they rarely owned and earned barely enough to survive. When word spread that government doctors were coming to town, many saw it as a blessing. They said they were offering free medical care. At a time when most black Americans in the rural South had never seen a doctor, the promise felt miraculous. No fees, no paperwork, no questions asked, just treatment. But the men who stepped forward that year, 399 of them, did not know they were entering one of the most disturbing chapters in American history. They were not patients, they were subjects. The study was officially called the Tuskegee Study of Untreated Syphilis in the Negro Male. Even the title carried the cruelty of its intent. Syphilis was not rare in the 1930s. It was deadly, painful, and progressive. Left untreated, it slowly destroyed the nervous system, damaged the heart, caused blindness, paralysis, insanity, and death. But by the early 20th century, treatments already existed. They were imperfect and risky, but they worked. Yet, the purpose of the Tuskegee study was not to cure syphilis. It was to watch black men die from it. The U.S. Public Health Service wanted to observe how untreated syphilis progressed in the human body. They wanted to know how long it took, what organs failed first, and how death arrived. And they chose poor black men because they believed they could. The men recruited into the study were never told they had syphilis. Instead, doctors told them they were being treated for bad blood, a vague local term that could mean anything from anemia to fatigue. The language was intentional. Confusion worked in the study's favor. They were given free meals, free transportation, free physical exams, and burial insurance, an incentive that mattered deeply to men who could barely afford to live, let alone die with dignity. In return, all the government asked was cooperation and silence. From the beginning, the study was unethical, but in 1932 there was no federal requirement for informed consent, no institutional review boards, no legal protections for human subjects. Still, many involved knew it was wrong. They continued anyway. As years passed, doctors came and went, administrations changed. The Great Depression ravaged the country, World War II reshaped the world, and the study continued. By the 1940s, something happened that should have ended Tuskegee immediately. Penicillin was discovered. It wasn't just a treatment for syphilis, it was a cure. By 1947, penicillin was widely available and became the standard treatment. It was cheap, effective, fast. At this moment, the Tuskegee study crossed a line so severe that it transformed from unethical observation into deliberate harm. Because the doctors running the study made a choice. They chose to withhold penicillin. Not because it was unavailable, not because it was dangerous, but because curing the men would end the experiment. Some of the men were drafted during World War II. Military doctors diagnosed them with syphilis and ordered treatment. The U.S. Public Health Service intervened. They sent lists of names to draft boards, ensuring these men were excluded from treatment. The experiment mattered more than their lives. By now, the study was no longer passive. It was actively preventing care. What makes Tuskegee even more horrifying is not just what happened, but who approved it. The study was supported by the U.S. Public Health Service, the Centers for Disease Control, CDC, the Alabama State Health Department, major medical journals, and leading universities. Articles about the study were published openly, presented at conferences, discussed by professionals. This was not a secret buried in classified files. It was hiding in plain sight. As decades passed, the men aged. Their bodies deteriorated. Some went blind. Some lost their minds. Some collapsed from heart failure. Their wives were infected. Their children were born with congenital syphilis, blind, disabled, or dead shortly after birth. The doctors documented everything. Charts filled with suffering, notes written with clinical detachment, photographs taken as evidence. All of it filed under data. In 1966, a young public health service employee named Peter Buxton learned about the study. He was horrified. He wrote letters, filed complaints, raised ethical concerns. He was ignored. 6 years later, he went to the press. In July 1972, the Associated Press broke the story. America reacted with disbelief, then outrage, then shame. Headlines exploded across the country. How could this happen? Government let men die untreated. 40-year syphilis experiment exposed. The study was finally terminated, not by conscience, but by exposure. By then, at least 128 men had died directly from syphilis or its complications. Dozens of wives had been infected. Children had been born with irreversible damage. The government settled a lawsuit for $10 million. Each surviving participant received about $37,500. No doctor was ever criminally prosecuted. In 1997, 65 years after the study began, President Bill Clinton formally apologized. Standing before the remaining survivors and their families, he called Tuskegee deeply, profoundly, morally wrong. The apology came late. Most of the men were already dead. The legacy of Tuskegee did not end with an apology. It reshaped American medicine forever. New laws were passed. Ethical review boards became mandatory. Informed consent became a legal requirement. But the damage went deeper. Tuskegee planted a generational mistrust of the medical system among Black Americans, one that persists to this day. When people wonder why minority communities are skeptical of healthcare institutions, Tuskegee is not ancient history. It is lived memory. Perhaps the most unsettling part of this story is not that it happened, it is how easily it continued. No single villain, no dramatic crime scene, no moment of rebellion, just paperwork, funding renewals, professional silence. Evil did not arrive screaming. It arrived wearing a lab coat. The Tuskegee syphilis study forces an uncomfortable question. What else has been done quietly, legally, and scientifically in the name of progress? History teaches us that the most dangerous abuses are not always hidden. Sometimes they are documented, published, and defended. Today, the fields of Macon County are still quiet. There are no monuments tall enough to match the scale of what happened there. But the story endures, not as a relic of the past, but as a warning. Because when science forgets humanity, knowledge becomes cruelty. And when society stops asking questions, injustice can last 40 years, silently.